asking you some questions about your medical history today.
Hi,
So can you state your full name and date of birth?
Jane Smith, October 10th, 1988.
Alright, Jane, what brings you here today?
I'm here because I have some wrist pain, back pain, toothache, and some indigestion.
Okay, since we have limited time, what's your main concern or what bothers you the most?
My back pain bothers me the most.
Okay, and if we have time, we'll go into the wrist pain, toothache, and indigestion, and then if not, we can always make up a follow-up appointment.
Okay, thank you.
Have you seen your doctor about this back pain?
No,
And when did the pain begin?
5 days ago.
And what were you doing when this pain began?
Nothing out of the ordinary. I just woke up and my back started hurting.
And where's the pain located?
My back.
Can you point and show me where?
It's right here.
Okay, so it's the lower lumbar region of your back. Have you experienced this pain before?
Yeah, but usually it happens when I get up the wrong way, but it goes away in about 2 days.
Okay, and then how long does the pain last? Like minutes, hours?
The whole day.
Whole day. And what does the pain feel like?
What do you mean?
Like, is it a sharp, dull, or achy pain?
Achy.
Okay. And what makes the pain better?
Just lying down. In the past I used warm water bag, which loosened up my muscles, but it doesn't seem to be working this time.
Is there anything that makes the pain worse?
Any movement.
Does the pain travel anywhere, or is it just in your lower back?
It's just in my lower back.
Alright. Is there a certain time of day the pain is worse?
In the morning.
And has anything changed before you got the pain? Maybe the way you sleep, a new mattress?
I did get a new mattress about 3 weeks ago. It's a harder mattress, so it's supposed to be better for my back.
And on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable, what's your current pain level?
6.
6. And have you been taking anything for your back?
Tylenol.
Tylenol? And what's the pain level after taking Tylenol?
2.
I'll be asking you a couple of questions about your medical history. Do you have any known medical conditions?
I have high blood pressure.
When were you diagnosed?
5 years ago.
So 2008. Have you ever been diagnosed with diabetes, high cholesterol, or heart attack?
No. But my dad did get a heart attack when he was 56.
And have you been hospitalized for any reasons?
No.
Have you had any surgeries?
I did have a knee surgery back in 2007 in China.
Okay, and then how about any injuries to your back, maybe a bad fall?
No.
Okay. When was the last time you visited your doctor?
6 months ago.
6 months. What was it for?
General checkup.
Did everything turn out okay?
Yeah, he just said my blood pressure was a little high and I should watch my diet.
Right. Do you have any food or medication allergies?
Yeah, I'm allergic to watermelon and penicillin.
What kind of reaction do you get with the watermelon?
My face swells up.
And the penicillin?
I get upset stomach and diarrhea.
Oh, actually that's not a true allergy. The penicillin has a common side effect of stomach upset and diarrhea. So you can take food with the penicillin to decrease that stomach upset.
Oh, that's good to know. Thank you.
No problem. And do you have any latex allergies?
No, not that I know of.
Okay. You mentioned you're currently on Tylenol. Do you know the strength?
No.
Do you remember what the bottle looks like?
It says extra strength.
Okay, so 500. And how often do you take the extra strength Tylenol?
Just when I need it.
Okay, on an average day, how many tablets of Tylenol would you take?
2 to 3.
2 to 3. Are you on any other medications? You mentioned you have high blood pressure.
I was on, I think, lisinopril.
Okay, lisinopril 5, 10, 20.
I think it started with a 4, but I'm not really sure. I haven't been taking it.
Oh, is there a reason? Is your blood pressure well controlled now?
No.
Why did you stop taking this medication?
I ran out of my insurance last month.
Oh, I'm sorry to hear that. Your blood pressure medication is important to take. It can help decrease your risk of heart attack and stroke. So after we're done, I can refer you to our case management team and they can help look into low-income drug insurance plans for you.
Oh, thank you. That's really helpful.
Okay. So are you taking any vitamins, supplements, or herbs?
No.
Okay, so we're going to ask you some questions. questions about your social history. Were you ever a smoker?
Yes.
And how much did you smoke a day?
1 pack per day?
Have you ever tried to quit?
Yes.
So you quit?
Yes.
When did you quit?
When I was 17.
How long did you smoke for?
About a year.
Okay, so ages 16 to 17. And how often do you drink alcohol?
Just social occasions.
And how often is that?
About once a week.
How much do you drink?
A glass of beer.
Okay, what's the size of that glass?
Like this much.
Okay, so since you're taking alcohol, you want to avoid drinking because taking alcohol with Tylenol can cause permanent damage to your liver.
Oh, that's good to know.
Yeah, so have you ever used any recreational drugs?
What's that?
It's like marijuana, cocaine, speed.
No.
Okay, and what do you do for a living?
I'm a full-time student.
Okay, and do you work at the same time?
No, I lost my job a month ago. That's why I can't get money for my insurance and medication.
Oh, okay, yeah, so hopefully our case management team can help you out with that.
Okay.
What's your diet like? How often do you eat out?
I eat out like 5 times a week.
And then what about on the other days?
Oh, I cook at home on Saturdays and Sundays.
Okay, what do you eat when you go out?
McDonald's.
Okay, and what do you cook?
I make like spaghetti most of the time, but I don't really cook any veggies.
Oh, and then how often do you exercise?
I don't really exercise.
Who do you live with?
My housemates from school.
Okay, and do you have any pets?
No.
Alright. I'm going to ask you some questions about your sexual history. Are you married or seeing anyone?
No.
Alright. And are you sexually active?
Yes.
And are you having sex with men, women, or both?
Both.
Okay, and what type of protection do you use during sex?
Condoms.
Do you always use protection?
Yes.
And are you on birth control?
No.
Okay. Have you been tested for sexual diseases?
Yes.
And when was your last test?
2007.
Okay, what was the result?
Negative.
Right. And how many partners have you, and have your partners been tested?
No.
Okay. And how many partners do you have currently?
3 men, 2 women.
Alright. I'm going to ask you some questions about your family.
Wait, I'm just here for back pain. Why do you have to ask me so many questions?
Well, since this is your first time at our clinic, we want to get a complete picture of your health by asking these questions so we can find the best treatment option for you.
Oh, okay.
So earlier you mentioned your dad had a heart attack at age 56. Does he have any other health conditions?
He has diabetes.
And what's his age now?
60.
And does your mom have any health conditions?
She has diabetes.
Okay, and what's her age?
57.
Alright, and do you have any brothers or sisters?
I have a brother, but he passed away a year ago.
Oh, I'm sorry to hear that. How did he pass?
Car accident.
Okay, and what age was he?
15.
15. And do you have any children?
Yes, I have a daughter.
I'm going to ask you a few routine questions. They may seem silly, but please answer them to the best of your ability. What is your full name?
Jane Smith.
And what city are you in?
Vallejo.
Okay, and then what month is this?
February.
In the past few weeks, have you woken up with your sheets drenched in sweat?
No.
Any fevers in the past few weeks?
No.
Are you experiencing any muscle weakness?
No.
Has your weight unexpectedly changed in the past 6 months?
No.
Have you noticed any changes in your vision in the past few days?
No.
Have you noticed any discomfort in your chest in the past few weeks?
No.
In the past month, have you had difficulty breathing or feel like you're gasping for air?
No.
Have you been constipated or experienced diarrhea in the past few weeks?
No.
Have you experienced indigestion or heartburn in the past few months? If so, when did you experience indigestion or heartburn?
Yeah, I did feel some indigestion, but I think I just ate too much.
Okay, do you feel bloated or have a feeling of discomfort?
No.
Have you been peeing more frequently than normal in the past 6 months?
No.
And then how often do you have to go pee in a day?
About 3 times a day.
And then how often do you have a bowel movement in a day?
Once a day.
What is the first day of your last menstrual cycle?
January 30?
30. And have you ever been pregnant?
Yes.
How many times?
Twice.
How many live births did you have?
1.
And was your daughter delivered naturally or by cesarean section?
Naturally.
Do you have any headaches or loss of consciousness in the past?
No.
And how has your mood been recently?
Normal. Cheerful.
Right. And are you experiencing any pain or discomfort in your neck and shoulders?
No.
Okay. How about your hip?
Just a little bit because of the back. Got a lower back pain.
Okay. And your knee, feet, and ankle?
My left knee feels a little, just sore sometimes in the cold months because of the surgery.
Do you have any food or medication allergies?
Stop laughing!
And what kind of reaction do you get with the watermelon?
My face swells up, just like a watermelon. My face just swells up.
Okay. And then the penicillin?
Diarrhea.
No! That's your fault!
And then the penicillin?